and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. 1 year into the genocide in Gaza, the medical and humanitarian situation there has reached catastrophic levels. This according to the international medical humanitarian organization Médecins Sans Frontières, or Doctors Without Borders. Now, according to MSF, Israel's relentless violence has destroyed Gaza's already fragile health system. It's repeatedly displaced people who have been forced into smaller and smaller areas, and they've choked off access to desperately needed food, water, and medicines. So joining me on the show now is Dr. Yi Chun, who is a reconstructive surgeon based in Taiwan, who was recently part of an MSF mission to Gaza. Dr. Wu, thank you so much for being on the show with me today. I appreciate your time. Maybe we can begin our conversation with you providing us a bit of an overview of your role within the MSF mission to Gaza. How was it that you came to be deployed to Gaza, and what were the objectives of your role as part of that mission?
Okay. Hello, everyone. My name is Yi Chun Wu. I was deployed to Gaza in July this year, mainly because of the ongoing war. So there are a large amount of injured civilians, and mostly due to the blasting injuries and a lot of burn injuries also. So I was deployed there on this mission to help with these patients.
Okay, so can you tell me a little bit about more specifically what your responsibilities were? You're a reconstructive surgeon. I can only imagine the types of injuries that you had to deal with. What were your specific responsibilities, and how exactly did you use your surgical abilities there?
Okay, so like I said, there were a large amount of blast injuries and burn injuries. So when I was there, I worked with the orthopedic surgeons because a lot of them are open fractures with large soft tissue injuries, defects, traumatic amputations, and stuff like that. So also there were a lot of burn injuries, including the children. So we did a lot of reconstructive surgery, skin grafts and flaps, and also some amputations.
Yeah. Where were you at within the Gaza Strip? Are you able to share that with us?
Yeah, sure. We were working in the Nasser hospital. So currently MSF has a traumatic unit in the Nasser hospital. So I was working in that hospital at that time.
So that's South Gaza, right? Right at the south
That's
of
right.
Gaza. Were there any other hospitals in the area? I'm just wondering the scale of patients that you had to deal with. Did you have to accept all the patients who came to you? Were there other hospitals that were operating in the area with that could attend to burn injuries?
Okay. There were some small hospitals, local medical stations, but the only operating hospital in that area that was able to do these kind of surgeries and reconstruction was only Nasser Hospital.
Wow. And can you share with us how big was your team? How many people were treating the number of patients that came? Your colleagues, your teammates in Gaza, who could address these types of injuries, working on reconstructive surgery?
Okay. So we worked with the national staff there, which was the majority, and we were treating a huge amount of, I could say, overwhelming amount of patients in Nasser Hospital because there were a lot of mass casualty incidents. So the patients, including the inpatients, outpatient departments, the surgery, everything was overwhelming and way past the capacity of that kind of size of a hospital.
Right. Were you prepared? Were you surprised at the number of patients that came through and the types and levels of injuries they had?
Actually, before mission, MSF always provide us with adequate and very detailed information, but still it was very shocking to see in person when I arrived at the hospital that scale of injuries, and also the types of injuries on these types of patients, I was my first shock was the first day I arrived at the OT, the operating theater. The list was the first shock because on the list were around 20 patients, and half of them were minors, and around 10 of them were under the age of 10. So they were all severe blast injuries and burn injuries. So these kind of injuries occurring on these kind of patients was nothing I've ever seen in the years of my practice.
Right. How do you go about treating such a scale of injuries, doctor? I'm just wondering, you must have, you and your colleagues must have had incredible challenges trying to perform, not just reconstructive surgery, but the most basic care for blast and burn injuries, given what we're hearing is limited medical resources and the sheer number of patients that you're treating.
Yes, due to the severe lack of resources and personnel, so we often had to improvise. We were constantly lacking on very basic medical supplies like saline and betadine and stuff like that, or surgical gowns, and so we had to improvise with what we had. And also the staff, especially the national staff, they were working very, very hard. So it was very, very difficult for all of us.
So you say that even basic medical needs like saline and medical gowns are, but you're dealing with doing skin grafts for blast burns. How is that possible, particularly for children? Because many of these are children that have been injured.
Yeah, we had to make do with whatever we had and try to do the best out of what we could get our hands on site. For example, when we were lacking surgical drapes, the aseptic surgical drapes, we had to use other aseptic, any kind of sheets or blankets that were aseptic to use for the surgery. So it's these very, very small things like this, but they're everywhere. Everything is constantly lacking, and even like very basic stuff for the hospital, like electricity, water supply, air conditioning. This was not on a very stable level for an adequate medical treatment. But anyway, we had to make do with whatever we had.
I understand. I commend you and your colleagues for staying and doing what you can. Were there any encounters or experiences that have stood out for you? You've been home for a few months now, but are there things that you cannot forget that has stayed with you since?
I think one of them was the scale of the mass casualty incidents. So, for example, it was around mid-July. Of course, we have mass casualty incidents every week, but one especially stood out. I remember I was in the OT, I was performing surgery, and then they informed us that there's a mass casualty incident occurring right now. So we had to stop the surgery, and we went to the ER to help with the inflow of patients, which was huge. So it was complete chaos there. The ER was filled with patients, filled with families, and extending all the way to outside of the hospital. Everyone was trying to come in. The glass was shattered. The fence was torn down, and there was blood on the floor. People were screaming. Some patients were carried inside and then carried out again, obviously, because there was nothing we could do. And some of the patients, I remember on that day, there was a young lady. She had a near amputation, traumatic blast due to the blast injury. So we had to rush her to the OT for an emergent amputation because she was in shock. She was losing a lot of blood. She was pale and confused. Her conscience was not very good. So I think that was a very shocking experience for me. And also, if you look at the numbers, there were more than 150 deaths alone on that day in that single incident. So not to mention the amount of injuries, it was unmeasurable. So I think that is a huge and overwhelming number for any hospital in the world to deal with.
Doctor, can I ask you for a personal reflection? How has that mission with MSF to Gaza changed? Has it at all influenced the way you view your work, your perspective, professionally and personally?
Professionally, because during practice as a surgeon, we always attitude and skill, we always put out a profession, do it in a professional way. But I think emotionally, it has a huge impact on me because I think before leaving for the area, we all know what is happening there. We all don't know the numbers, but seeing it in person, knowing the people there, seeing them as colleagues and friends, or even just passing by people, it's very shocking to see and to experience what they have been experiencing for the past year. So I think emotionally, it's very sad actually to even think of it, even after the time I came back.
Well, I mean, as someone who has witnessed this humanitarian crisis firsthand, what do you think the world is not understanding about the medical emergency in Gaza?
I think that there is, to say it's a humanitarian crisis is an understatement, because the continuous war on Gaza, and also at the same time, the people in Gaza, they're under blockade, so they can't even run away. They have nowhere to go. So many of the staff, like when I was talking to them, many of them have moved more than 10 times, carrying everything, bringing their family with them, and move around because the continuous evacuation orders. So I think that no human being should live in such a circumstance. So that's why MSF calls for an immediate and sustained ceasefire. And also, we think that the blockade to Gaza should be ended also.
Dr. Wu, thank you so much for sharing your experiences with us. We appreciate your time and your efforts. Thank you. That was Dr. Yi Chun Wu, a reconstructive surgeon who's recently returned from a mission in Gaza with MSF. We're going to take a quick break here on Consider This. We'll be back with more. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our conversation about the impact of the past year of war in Gaza on its humanitarian and medical situation. Joining me now is Dr. Amber Alayyan, who is a paediatrician and a medical program manager for the Palestinian Territories, Afghanistan and Haiti, for Médecins Sans Frontières, also known as Doctors Without Borders. Amber, thank you so much for being on the show with me today, Dr. Alayyan. May I ask you to begin our conversation maybe with an overview of how you have seen the situation evolve in the past year? I mean, when you think about the work of MSF in Gaza prior to October 7th, which I understand MSF has been long operating in the Gaza Strip. What was it like before, and how has the past year changed in terms of MSF's operations and the medical treatment it's had to provide?
Okay. MSF has been working in Gaza for over 15 years, and we've been making a lot of really good progress in working with local providers, the Ministry of Health, and our local Palestinian colleagues. So we've been working on things like antibiotic stewardship, surgical care. We were working in a burns unit in Shifa Hospital and Nasser Hospital. We had done a lot of work with osteomyelitis, which is a deep bone infection as a result of the Great March of Return period back in 2018. And we've been making a lot of really good progress in terms of things like quality of care, multidisciplinary team approaches to surgical care, mental health care as well. And what we were seeing was over time really just a really good collaboration with the Ministry of Health and with the providers inside Gaza, and all good things for patients, basically, really just working toward really improved quality of care. It was a very robust health system, not perfect, but robust. And then, since this last year, what we've seen is a systematic collapse and destruction of all that work and all the healthcare system in general. And it's been really tragic. It's been really depressing.
So what is the current situation? What are the main medical challenges that MSF faces in trying to provide medical care?
Well, I mean, there's been just the idea that over half of the hospitals that were functional are no longer functional, that they've been destroyed, in fact. That makes it very challenging. The fact that hospitals are used as a target and that medical providers as well have been killed is very, very not only challenging, but just unacceptable. So we within Doctors Without Borders, we've had to move our activities multiple times throughout the war because it's no longer safe to practice in certain areas. And so we try to follow the population. So where they go, we'll go. But it's been hard. We were working in Shifa, then we were working in Nasser, then we were working, then we had to leave Nasser. We had to go to the south in Rafah, then we had to go back from Rafah to Nasser. And we've just moved dozens of times over the course of the year, which is unstable for all sorts of quality of care. But also, I mean, for us, it's difficult, but we'll adapt. But for the population who've moved, tens of times over the course of the year, it's even worse. And it's put their health at grave risk, but also the health of our staff.
Right. Could you just put this into context for us? Based on your work with MSF, how does the scale of this crisis in Gaza compare to the other conflicts that MSF has responded to, particularly in the ways of displacement that you just described?
Right. I mean, I can't speak for all conflicts over time. There's the ones that I know quite well. Like I know the Syria war quite well, and I know I worked in Syria and Iraq and have seen quite a lot of things in the Middle East, and we've worked quite a lot in sub-Saharan Africa. All wars are different. That's true. What's happening in Sudan today is equally atrocious, but different. So I can't say that, that one is necessarily worse than the other, but there are certain things that set Gaza apart. And one is that the population has nowhere to go. So typically what you can see even in Syria is that the population, while it wasn't easy to leave the country, Syria is a big country. And so for so much of that war, people could move from place to place, and they could flee their cities or their towns and then potentially come back and try to rebuild and potentially flee again, which was bad all into itself. But this, if I had to compare it, it's a little bit like the siege of Aleppo, where the population was stuck in Aleppo for a few weeks. But then the siege lifted, and this is like the whole strip has been under siege for a year, so people can't go anywhere, and the space where they can live is minuscule at this point.
And you mentioned that there's only a small number of hospitals that are operating compared to before. We spoke to a doctor who had volunteered with MSF. He was a reconstructive surgeon, and he spoke of the scale of blast and burn injuries. What else are the most urgent medical priorities at the moment? What are the most urgent healthcare concerns?
Okay, so I want to come back on if I can, on the blast and burn injuries, because you see these a lot in kind of very high-tech wars. So we did see this a lot in Syria. The difference is that, again, you have to be able to evacuate a patient or a whole family from the zone. And then because the care provided or necessary for blast and burn injuries is not just surgical, but there's a whole medical component that's non-surgical. There's antibiotics that are needed. There's a huge risk of infection. There's psychological needs. There are nutritional needs. Just a huge package comes with the care provided for patients who are involved in traumatic explosions, for example, and burns as well. So, and huge issues with pain management. So really continuity of care, because people will come back not for one surgery, but multiple surgeries sometimes over years. And so that requires a safe place to work, and that requires the patients to be able to move freely back and forth to be able to get this kind of care. So that's already one thing that distinguishes this setting from others and other conflict zones. And then in terms of other medical needs, so the longer this goes on, the more at risk the population is for huge epidemics. Gaza had a really great vaccine coverage rate before the war. The population, they loved their doctors, so they would go and they would get their vaccines, and they had a great, really good vaccine coverage rate, over 90% before the war. The problem is that there have been children who've been born since the war happened and haven't been able to get vaccines. So that first year of life is critical for vaccinations. And so, I mean, this is the case of polio that was confirmed in July is exactly that. The baby who had that was 10 months old, who was born basically during the war. And then it makes people, these types of illnesses are epidemic prone, right? So they can spread quite quickly. So the situation of not having enough food or water makes it dire, or dirty water in general. So a lot of the issues that we see that are kind of acute are like skin infections, respiratory tract infections, diarrhea, these types of things that you get that you get when you are living in squalor, when you're living in really poor living conditions, without access to water or very good shelter, when there are a lot of people crowded into tents or having to share toilets or showers. And so that's one of the things we're seeing. We're also seeing things like exacerbations of non-communicable diseases. So if you think back to like the COVID period where people were kind of staying at home because they didn't want to go out, and then at some point we would have floods in emergency rooms because, okay, as restrictions let up, people would flood to the ER, they would flood to their doctors because they had these non-communicable diseases like asthma or like heart disease or like diabetes that had gone kind of uncontrolled for a long period of time. So that's kind of like Gaza right now. These people who are afraid to leave their shelters, their tents, because there are bombs dropping everywhere and because it's just very difficult to move. And so they'll wait until the last possible minute before they'll present to the hospital, like until they absolutely have to. And so then they come in with a degradation in their care, basically, that they haven't been able to get access to their chronic disease medications in months. And the other thing that, because you had asked me earlier about things that distinguish this war from others, is also just absolutely no access, like no access for medical providers, no access, safe access.
Right.
And then our supplies that just stopped. We just have,
Dr. Alayyan, so what is being allowed in and what is not being allowed in? We hear a lot about what's severely lacking. Give us an idea of what is being allowed in and the amount and the scale based on your knowledge.
There are hundreds of trucks that are sort of just waiting on various borders, whether they're in Jordan, whether they're in Egypt, and they're being blocked from getting in, and there's just a huge delay in getting things in. There's not one specific thing that's missing, or two, or even 10 or 200. The problem is that it's very arbitrary what's allowed in. And so you submit your list, and if there's one thing that the Israeli authorities deem as sort of dual use or questionable item, they'll remove the whole list. So it's like you can't get the entire cargo in because this one thing is questioned by them. But some of the items that are dual use are things that we would really need in healthcare. So for example, chlorine tablets, you need those to chlorinate the water. So when they call it dual use, they think that it could be used for a military purpose. But when we're medical organizations, we're trying to chlorinate water so that we can stop diarrhea from spreading. So there are things like that. And then when the cargo gets in, if it gets in, there are times that it's damaged. We've had crutches being broken, things like that. And it just makes it very difficult to get the adequate amount of aid to the population, whether because we physically can't reach them because it's unsafe, or they can't reach us, or because the hospitals and healthcare providers are the hospitals are being destroyed, and the clinics as well, and the population, the healthcare providers are dying in the process, or because we can't get the supplies in.
Right. Well, we mark a year of this relentless war in Gaza. Can I ask you what message you would like to convey to our audience tonight regarding the situation there and the urgent need for support of the survivors of this war?
We need absolute access to this population. The war needs to stop. It's not like the war has to stop. This is just, it's untenable, and it cannot go on without, there's already, I was going to say without dire consequences for the population. We've already seen the dire consequences for the population, and it's happening before our eyes, and it's enough. It's enough. Enough with the bombings, enough selling weapons to continue the bombings, enough buying weapons to continue the bombings. It's just enough. It's enough. There are more children dying in this war than in 4 years of previous wars. These are civilians. It's enough. It's enough.
We hear you. Thank you so much, Dr. Alayyan, for being on the show and sharing your insights with us. Appreciate your time. That was Dr. Amber Alayyan from MSF, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.